Uh-oh.
Hey guys, we are live and welcome to Urban Health Outreach Media. Welcome to Urban Health. I can't even say it. I'm sorry. Welcome to Urban Renal Talk with Tamika and Steve. Oh my goodness.
We gotta have fun sometime. You know what I'm saying?
Hello.
Yes. Welcome to Urban Renal Talk with Tamika and Steve. Thank you for joining us. Yes. Hey, Tamika, what's going on? It's another week.
It's another amazing week to wake up with gratitude. That's my
absolutely.
Wake up with gratitude, and when you wake up with gratitude, it just changes how you look on so many things in life.
Absolutely, and you got to have fun. I mean, if you know, we wouldn't be human if we didn't make mistakes. You know what I'm saying?
Well, you know what, Steve? My mom always said that when you make mistakes, that's also how you learn.
Oh, absolutely, absolutely.
And you never know who needed the laugh.
Absolutely. So, absolutely. Yeah. And Tamika, before we move on to our guest, I just like to again thank our sponsor, Renal, the makers of Renal Supplement. And let me just tell you, these statements have not been evaluated by the USDA and Drug Administration because it's a supplement, it's not a medication. But these products, they're not intended to treat, cure, diagnose, or to prevent any disease. However, if you never tried a pre or probiotic and you're dealing with low kidney function, you're in that stage 3, 4, this can be a benefit. It could be a game changer along with dietary changes as well. Because this eats the probiotic and the prebiotic eats the bad nitrogenous waste that's in the gut that will help put less strain on the kidney, Tamika.
Yes, and you know there's so much research on how the gut affects your health.
Oh, absolutely, and they're the only company that has something called intestinal dialysis for kidney health. Yes. Intestinal, it says it right there. It eats up the nitrogenous waste in the intestines and then it eliminates it out through the stool. So, yes. Great supplement. We got it going across our banner. Yes. If you want to order it, just put in the code Urban Kidney 20 and you definitely get a discount. But Tamika, our guest tonight, man, you be finding a lot of great kidney warriors across the globe, especially international. Guys, share this broadcast and bring other warriors in.
Because it's just not affecting us here in the United States. It's affecting everyone all across the world. So it's great to show someone outside of the United States, you know, with the same issues.
Absolutely. You know,
and just to let warriors know that they are not alone.
Oh, absolutely. We know this disease affects millions of people globally. And we just been so fortunate. You've been just amazing in finding fabulous, as Lisa Baxter say, fantabulous, fantabulous guests internationally. And that's why y'all need to share this broadcast right now and bring other warriors here tonight to see Simone Moniz from Brisbane, Australia, share her experience and how Australia is dealing with kidney disease and what they're doing to decrease the rate over there. So how did you find our guest, Tamika, before we bring her on?
Well, I found Simone on Instagram, you know, where I like to look at a lot of kidney warrior stories and stuff like that, because I realized that they're more vocal on Instagram and on TikTok than they are on Facebook.
Wow. Really?
So I like to reach them near versus on Facebook. And I found some on Twitter too.
Right. That's awesome. Just keep up the great work because we need international guests on here to share their story. And Tamika, what, maybe 3 years ago, we started off on these doing on the phones doing Facebook Live and never had a international guest. And here we are today.
We come a long way. So I'm just going to give you guys a little backstory about Simone.
Sure.
Like he says, Simone is from Australia. She had kidney disease and renal failure at the age of 19. Simone received her first kidney at the age of 23. And unfortunately, at the age of 27, her kidneys failed again and she's back on dialysis. So I'll bring Simone on and let her continue to tell her amazing story and how she overcame obstacles.
All right, let's give it a special VIP treatment. So without further ado, all the way from Brisbane, Australia, Simone Moniz. Wow.
Hi.
Hey, Simone Moniz. Hello. How are you?
I'm good. How are you?
Great.
Awesome. Wow.
So, real quick before we start the show, Steve and everyone out there, Zoe is sitting next to me. So if you hear her talking, I apologize in advance, but I am a mom. So
that's okay.
Not every show she
this
can be
is live.
So let's
be yourself. This is live.
Yes.
But
Yes.
Simone, before you share your story, do you hear a lot from people in Australia that you don't look like you have kidney disease? Do you hear that a lot?
Yes, every day.
Wow.
I mean, you're so beautiful. I mean,
thank you.
if you didn't share your story, if I didn't know you, I wouldn't think that you had kidney disease. I'm just going to be honest.
But Steve, what does kidney disease look like? You know, when people
I know.
What does it look like?
It doesn't have a look, but I guess with me had worked in dialysis for so long, I had this look of people with their skin maybe ash, red eyes, and just not overall feeling good. But again, there's no particular face on it, but it's just amazing that you're beautiful. I'm just going to say that. Thank you for coming on.
Yeah, no, you're welcome.
Yeah. So, how does your story start?
So originally I was diagnosed with focal segmental glomerulosclerosis, so FSGS, at the age of 13. Everything was fine as I went through high school. Things started to go down a bit through year 12 graduation. And then when I was 19 was when my kidneys completely failed. So it was a quick turnaround. I got back from my sister's wedding and the next day she's taken me to hospital. So I started when I had 2% kidney function. The week prior, I had 12%. So I'd lost 10% in 7 days. So it was straight to hospital to get a catheter put in. And then I was dialyzing 4 days a week. The first couple of weeks, and then I actually continued on to do 5 days a week, 2.5 hours on 3 days and 2 hours on 2 of the days. I traveled through dialysis for about 3.5 years. So through those teenage years, through the early 20s, still working full time. and then had a transplant at 23. That was amazing. So the first 3 years, I had above 90% kidney function on one kidney. But what goes up must come down. And then the last 12 months, it was quite a steep decline, back down to 11% when they put another fistula in, and then started dialysis again at 27. And I've now been on the waiting list for 4 years for another kidney transplant.
Wow. Now, what caused the rejection of the first transplant?
It was a reoccurrence of the FSGS, because it attacks the autoimmune as well. I did have a 50% chance of it coming back. Round 2, the next time, I will have a 90% chance of it coming back, but they will attack it this time with plasma exchange, is what the plan is. So once I have a transplant, I'll essentially still be on a dialysis machine, having plasma exchange probably 3 times a week to start with, and then they'll gradually break that down over time, and they're hoping that by doing that, they'll actually prolong and hopefully have the kidney for a lot longer this time.
Wow.
Yeah.
Now, let me ask you, in Australia, is there a big push on prevention?
There is, but like I'm an ambassador for Kidney Health Australia. So I guess that's our non-for-profit organisation over here that tries to do those promotions and fundraising activities to promote kidney health within the communities. But I guess it might be the same over where you are as well. Everyone knows about cancer. Everyone knows about, what the Heart Foundation does. Everyone's in line with, childhood cancer, leukemia, all of it. But no one actually understands how much kidney failure and kidney disease can affect people. We've probably got 1.5 million Australians that have kidney disease that have no idea. That's about the statistics over here. Yeah. It's 1 in 3 people probably have it, but don't actually know it, don't know what the symptoms are. That it's pretty
And what's
high.
the cause? What's the major cause? Diabetes and hypertension?
Diabetes and hypertension are the main causes over here. Yep.
Yeah. Years ago, I read about Australia, and I read that they have a high rate of diabetes.
Yeah.
And that's where a lot of the kidney failure is from, diabetes and hypertension, but they have a higher rate of diabetes. So they have a lot of different prevention programs for diabetes. At 19, how did the change make you feel?
It was hard. I think I had a lot of support from friends and family, but what I found the most was no one actually knew what I was going through. There was no one for me to be able to talk to. I didn't know where to go. I didn't know who to reach out to. And when I stepped foot in the dialysis centre for the first time, I was the youngest by about 40 years. So that was quite daunting as well. Just walking in and all of a sudden you're the resident grandchild of the unit. And like, they're all lovely. Like, all the patients are lovely. They treat you like a granddaughter, but it's just so confronting at such a young age. And I guess for the first couple of months, you're so sick that, all your friends are going out clubbing. They're all, we can drink from over 18 here. So, they're all heading out dancing in the nightclubs and whatnot. And you're sort of like, I actually am too tired, or I don't feel well, or there's no way I'm going to survive, 8 hours on my feet at night. And there was also like the whole fluid retention piece as well. Before I started dialysis at that age, I had 15 kilos of fluid retention that had to come off. So, you're uncomfortable with that amount of fluid on. So it was just finding people that actually understood how you're feeling and actually respected, you know what, you're actually not feeling okay. I completely understand. Whereas you have some people at that age that can't comprehend the amount of life changes you're going through and just think, oh, well, you never come, I'm not going to stop inviting you. So it's not about that. It's actually just about a bit of understanding. So what I did decide to do about 2.5 years ago, Tamika, which is where you found me, was start up the online Instagram page and an online Facebook page, which I basically just talk about my life in the day of, like, I'm going to dialysis, I'm climbing a mountain, you know, I'm studying, I've opened my own business. I'm working full time for another company as well. Like, I'm just showing that it actually doesn't matter. You just do what you can. If you feel fine, go out and do something. If you don't, that's actually okay. Stay at home, you know, chill out, relax. But yeah, the whole idea was to show people that the young people of the world can also be affected, and you're not alone. Like, I've had heaps of people reach out, you know, across Australia saying, you know, I'm 30, like, this is all brand new to me. Like, I'm so scared. And it's like, you know what? You're going to be scared, but it's actually okay. And you'll get there. Like, just one day at a time, it'll happen. So yeah, it's just about, you know, showing people that there's hope. Like, I remember being told, I'd be lucky to see my 21st birthday when I was 13. I was like, oh, cheers. But, you know, 10 years later, like, I'm 31 and I'm fine. So it's taking that fear factor out of it as well. But yeah, like, just adding some positivity in the world. Like, it's not all that bad. Like, we can do this.
Wow. Now, let me ask you, Simone, like, here in the United States, it's unprecedented. You have an explosion of kidney treatment centers all over the United States. In fact, in California, in Inglewood, California, there's more dialysis centers than there are McDonald's, and there's 144 dialysis clinics within a 25-mile radius of this city. Now, in Australia, is it the same? Is there a dialysis center booming all across Australia? Give us the setup of where these treatment facilities are located and how it's presented.
Well, definitely not that many. So, for example, where I am, so I live now, I'm not sure of the distance differences, but we work in kilometres. So I'm about 120 kilometres away from my dialysis centre. So I travel about an hour and a half to and from to get to mine. And that's 4 days a week for me. We have most of our hospitals are equipped with units through the public health system, and then we have some private satellite units. So when we talk about how many units there are, like, I would say Brisbane would have maybe 10, and then you've got wider Brisbane that there might be another 4 or 5. We certainly don't have as many as you have that you're talking about. I think one of the things that finds the hardest for patients is actually getting into another unit if you want to go away, if you want to go somewhere else, even to see family. It's actually quite difficult. So we actually have what's called a big red kidney bus. So New South Wales and Queensland both have a bus at the moment, although I don't know if it's running during COVID. And the bus travels up and down the states for 6 weeks at a time, stopping at a new location. And it has 3 chairs and 3 machines, and it's a fully equipped unit on a bus. So there's a nurse that travels on these buses that basically hooks up patients, and they get to book in. And that's all run through Kidney Health Australia as well. So you just log on, and if they've got some spaces in the place that you want to go, you just submit your name, submit the paperwork, and you get to pop in and have your treatment whilst you're away. So it's really helping. Yeah,
on
it's
a
really
bus.
on a bus. I've got some pictures I'll have to send through. But yeah, like I've done the bus before because I struggled to get a unit seat down in New South Wales because they're actually full. They're over capacity in Australia, but we're not popping them up everywhere either. They're actually encouraging home dialysis to get people into home treatments. But yeah, the bus basically travels up and down, and it's great. So I was part of a massive fundraising project for Queensland. So we've raised $250,000 so far towards a bus. Yep. So now we're on the source for a bus to get it decked out, and then we'll have a bus in Queensland as well.
Man, that is awesome. I mean, wow. We had a couple of questions I want to get out the way. One from Tamika Small. She wants to know, do y'all use the same kind of machines as they use in United States? What kind of dialysis machines do you use?
So we have a mix. So I am with a Fresenius unit. So I have the Fresenius 5008.
Mm-hmm.
Yeah. We also have some units that still have some of the Fresenius 4008s. And we've got Baxters. Now, I can't tell you what type of Baxters,
Sure.
But there are some units that also use Baxters.
Yeah, it's kind of a difference. Even though it's Fresenius and we have Fresenius over there, their machines for international, they're kind of designed a little different. You seen that, Tamika?
No, I haven't.
Yeah, they got some real nice designs to their international, like European machines. One question from Lisa Baxter. She wants to know, does the center, do they use techs, nurses, and do they train at the facility where you work?
Yeah, so with the home dialysis patients, they go through essentially, I think it's a 6 to 12 week training program, and that's at a nominated dialysis center where the tech teaches them how to use the machines, and someone will also teach them.
Oh, well, no, I'm sorry. I'm talking about the staff. Like, does the staff, they learn and train at the facility, or do they go somewhere and learn and come back and work at the facility?
No, they train in the facility. All satellite units that are Fresenius have their own sort of tech, and the tech may be responsible for home patients as well, but everyone trains in the clinic. So they'll be taught by tech, and there's also like nurses. So we have grading with our nurses. So the nurse unit manager, for example, might teach cannulation techniques as well to upskill anyone that may have previously done a certain technique in another dialysis unit, teaching the new ways of doing things, or, whatever the standards are that have changed.
Wow. Okay, Australia. Things a little better over there.
One more question. Oh, go ahead, Tamika.
No, go ahead.
I just want to ask this one question. Does insurance cover it? How is dialysis covered?
It depends. So we have two systems. We have a public health system and we have a private health system. So if you've paid for top cover, like right out there, dialysis will be included. Otherwise, if you don't have the cover, then it's under the public health system. So the public health system would necessarily mean you'll go to a public unit, which is usually attached to hospitals. And the private units will be usually the satellite units, or in a private hospital. And those treatments are essentially covered once you pay an excess as well on your insurance. But they basically bill your insurance company. So, for example, my insurance is 2,800 Australian dollars per annum for the top cover. And then the dialysis company basically just bills my health fund for each treatment. Whereas in a public health system, they wouldn't have to worry about paying any insurance. It'll be all covered under Medicare, which is the public health system that we have here.
Wow.
So
Yeah.
is there a lot of patients that receive Medicare, or?
Everyone, all Australian citizens have Medicare. Everyone has Medicare across the board. Depending on, so everyone has Medicare, but if you're on, I guess, benefits from the government, like Centrelink benefits, you'll get, certain things bulk billed directly to the Medicare levy. Whereas if you're a private patient, you still have Medicare, absolutely. You're just paying to be able to use the, private hospitals or private specialists, access to the, private dialysis units, IVF, things like that. Just depending on what's covered, dental. Yeah.
No,
I'm
Tamika, she's not laughing at you.
Wait, my green screen fell down. Oh my God, that was so embarrassing. Okay, I'm back. I'm so sorry.
That's a blooper. We gotta put some bloopers together.
Oh my gosh. Yes.
Yeah, but wow, that's very interesting about the two-pay system there.
But did you hear, Steve? Everyone has Medicare.
Yeah.
So there's free medical over there?
If free, it's Medicare, but it depends on, if you're on like government benefits and you've got a healthcare card, then absolutely your medications will be a base rate. Usually around the $5-6 Australian dollars. But if you don't have that Medicare, that healthcare benefit, then you'll still have to pay the standard, whatever the cost of the medication is, anywhere from 25 to 40 Australian dollars. But it means like if you go to the doctors can bulk bill Medicare rather than charging you, essentially. So we have that like levy, I guess, set up. And that comes out at tax time as well. So we all pay a Medicare levy at tax time as well, which kind of offsets that for the country as well.
Wow. Now, go ahead, Tamika.
What was your biggest hurdle, with going back on dialysis the second time?
Probably the readjusting. I had to change the role that I was doing at work. I was living on the Gold Coast, so it was about, packing my stuff up and moving back to Brisbane. And it was probably this readjusting, like I was getting used to, being able to eat all the ice cream in the world, being able to drink all the water in the world, to having to go back to, 500 mils a day. It was tough to try and explain it, to friends, because I had holidays booked overseas, and it was like, I can't really do this. I managed to get away on one and went and did Vanuatu and all the islands about 3 months prior. But, as for Christmas in New York, for example, that's now on the back burner until I have a transplant. And then I'll go and do my white Christmas. But yeah, it was probably just the readjusting. It was hard. You just got back to some sort of normality. I felt like I had 4 years to catch up on from, the 3.5 years of dialysis. And then all of a sudden you're back in that spot. It's a bit, how you going?
Right. Monet, I'm calling you by your last name, Simone. Dad Vice TV, he wants to know, and if you get a chance, check out his YouTube channel. I'm not sure if you're on YouTube. It's Dad Vice TV. Very great kidney coach, renal warrior. But he wants to know, is a renal dietitian provided to help try and delay or avoid the need for dialysis in Australia?
So when I was first diagnosed as 13, we do get like a referral to a dietitian. And absolutely, with my particular kidney disease, I had to cut protein out of my diet. So they helped with that, to put that diet together, to reduce the effects of the protein in my urine scarring my kidney. So definitely they do share out like dietitians. Again, it depends on what unit you're in, where you are, as to how accessible that is. So I'm in a satellite unit, so I'm not attached to a hospital. So mine would be a referral, and then I would go and make an appointment and see this dietitian outside
Wow. So they
of
don't
this
come
appointment.
in like every month with your blood work and go over it and tell you what you need to do.
No.
Wow.
The nurses will, like, the nurses are pretty good. So they'll come in and go, hey, here's your clearance, here's your phosphate, here's your protein. If my protein was down, they'd go, you know what, you need to eat a bit more of this. Or if my phosphate was up, it'd be, you need to back off the cheese and pizza. But yeah, like the nurses are pretty good in that sense. They really do care. So they'll come and give you a sheet and it will tell you how you went for the month. It'll tell you your clearance. And it will say, hey, you know what, you're doing great, stick to what you're doing, or hey, you maybe just need to up this a bit or bring this down a little bit. So we rely heavily on our nurses over here to help the patients as well.
Wow.
Right.
Tamika.
No, go ahead.
What? Oh, is there?
No, I was going to ask a question. Go ahead.
Okay, is there a social worker in the unit?
Again, not in my unit. I'm a satellite. The hospitals would have one attached. But like, I'm only human, and I'll admit I've had breakdowns before. And I've been on the phone to my nurse unit manager and gone, you need to ring the unit in New South Wales, which is probably about 800 kilometres away. I'm coming down to my sister's. There's no ifs, buts. That's it. I'm coming. And they're pretty good like that, and they'll talk to you and things like that. But in terms of an actual social worker, you'll either need a referral, or if you're in a hospital, then you would obviously have social workers in the hospital. But again, I'm in a satellite unit, so we're not attached to a hospital as such.
It shouldn't even matter. Like, they're needed in
that's very different.
Dietitians is needed in every unit.
Yeah.
Especially for seniors.
Yeah. That is crazy.
Yeah. Hey, Simone, do they use prednisone still there?
Oh, yeah. Yeah, so we do. I haven't heard of many dialysis patients being on it, but from a transplant perspective, absolutely. So generally, like, I know personally, I've been on 50 milligrams. 50 grams straight after the transplant. And that just makes your face go. And puffy and the moon face. And then they start to taper you down over a couple of months. So I think as a general rule over here, we're told expect to gain anywhere from 5 to 10 kilos in the first 12 months after transplant. And then you'll start to lose it as the prednisone's tapered down. But they also use it when you're first diagnosed as well, to try and combat the kidney disease as well, to slow it down.
Right. So did you start off with nephrotic syndrome, or it automatically was FSGS?
Well, I was diagnosed with both at the same time.
Right.
And that was after a biopsy. So they tried for about 3 months through blood tests to try and figure out what was going on. Couldn't do it. So it was a biopsy, and then that's how they determined that it was the FSGS. And they did mention like a secondary nephrotic as well.
Secondary nephrotic. So at 13, how did they treat you for it? And I'm asking because I have a son, not had, because he's still with us, and he had nephrotic syndrome, and they treated him with prednisone. He was on prednisone for years, and he swelled up, as you said, and whatever. He remained overweight, and still to this day from the prednisone.
Yeah. So I was the same, prednisone. Prednisone, blood pressure medications as well. My blood pressure was quite high for that age. And I had to cut all the protein out of my diet. I was also on diuretics as well, because the fluid retention was insane. Like I remember struggling to wear socks because the fluid would just build up above the sock. So you'd have a normal foot, but then you'd have this imprint of the sock and then just this leg of fluid. So yeah, that's what I was treated with to start with.
They didn't have any sodium restrictions?
Not that I can remember. Like it was quite a long time ago. Like I definitely remember the protein restriction. I didn't eat a lot of salt anyway.
Okay.
As a child, so we didn't have a lot of takeaways or things like that, or add salt in. But yeah, so protein one was definitely a thing. I think I went down to 50 grams of protein is what I was allowed per day, which isn't a lot.
Right. What did you tell your friends? Steve, like at 17 and 19 and 23, you know, I know your friends may have a lot of questions of what's going on what's going on with you. How did you explain it to them?
So when they wanted to know about the disease itself, I basically said that the more protein I have, the more it scars my kidney. And it's eventually just scarring it away to nothing. The disease itself, that was the easiest way I could explain it. In terms of dialysis, it was a grease and oil change. So I'm sitting in there, I'm getting all the stuff ripped out and I'm getting new stuff put in. You know, we used to have jokes about it as well. It was the best hangover cure. So if we'd gone out on a Friday night, then I'd be booked in for a Saturday and book me up. You know, wouldn't have a hangover. Great. But yeah, it was probably, yeah, it's just trying to explain it in a way. And the same with the fluid, you know, I laugh. I have to have a laugh about it. Like I walk in and I come out 2 kilos lighter. Like what a great weight loss treatment. But you know, I think you've got to have that humor to it. And it's the only way. Like it's really hard to explain to people, you know, yes, I'm attached to a machine for 16 hours a week, but I'm still working. Like I'm not sitting there having a good time. Or, you know, they don't understand that, you know, some people think, oh, well, you can just watch Netflix. It's like, yeah, but you 16 hours a week in the same spot, you can't move. Like your arms in one spot, you're not exactly, you know, the comfortable like you would be on your couch at home. You know, so I think people try to understand, but then they don't actually fully understand, you know, you're having needles put into your arm. You know, it's not, we're not talking about baby needles either. You know, blood coming out, goes through the machine, strips off all the bad stuff and goes back into you. And that just keeps happening for 3 hours for me.
Right. Lisa Baxter, she asked, do y'all have support group meetings, monthly meetings in Australia?
So you're right. They have support groups. You're more than welcome to attend the support groups. You're more than welcome to sign up. At the moment, they are like on Zoom calls because of COVID. They're avoiding, obviously, gatherings. We also have Kidney Health Australia has groups as well. And we also have Facebook groups. So we have an Australian dialysis community group, for example, that someone's created. So, you know, people can jump in and ask questions and, you know, get not advice, but just some reassurance that it's not just them that it's happening to. So, yeah, there's definitely support groups out there. But again, you've got to look for it. It's not like front and center in front of your mind. It's not like the Cancer Council, for example, that has an ad on TV and you know where to go. We're still at that stage where I don't know if people in Australia fully understand kidney disease and how it can affect them so quickly. Australia's not there yet.
Well, that was kind of lead to my next question. Like, if I was to come to Australia and turn on the TV, would I be most likely to see an ad for kidney disease or PSA?
No, absolutely not. You'll see an ad for, I guess, mental health's a big push over here at the moment, which I agree with COVID. You'll see ads for the Cancer Council or the Cancer Foundations over here. You'll see stuff for Heart Foundation, but you'll barely see things for kidney health. Even organ donations, quite low media coverage as well.
Wow.
And it's just, yeah, like Kidney Health Australia do advertise as much as they can through Facebook and those channels as well. But in terms of turning on the TV, you're probably more likely to see a news update than what you are with anything to do with kidney health.
Right. Why do you think that's the case? I mean, because it's here too. It's like the cousin no one wants to talk about is in the house.
Yeah, if you want my honest opinion, I think it's who you know. I think that if someone on like high up in a broadcasting company, for example, or even on a news company, if someone they knew, I think, was going through it, or a family member, I think it would be very different. I think you hear stories all the time, of people that, like, husbands or partners, like celebrities that have been diagnosed with cancer, or mums being diagnosed with cancer. You hear about it straight away. But I'm yet to hear anything about, anyone with kidney failure, or, someone with a relative with kidney disease. I just don't think it gets the broadcasting because, A, no one's talking about it, but B, maybe because there's actually no celebrity push behind it. And I think that's very sad, with the amount of people that it affects worldwide. Yeah.
Wow. That's crazy. You think as many people have this disease, it would be more conversations, it would be more media coverage, it would be more billboards. It would be more education, more prevention than what it is.
Yeah.
Are you still there, Simone? Look like she froze up.
Yeah. She probably come back on it. But see, so this is worldwide, the lack of education, or lack of
there she go.
awareness.
Yeah.
Yeah, you had froze up for a moment.
Yeah, what I was just saying is I think that we have the ability to prevent so many people from ending up in end-stage renal failure, that I think that they should be throwing more things at it. Like, if we, for over here, it's 1 in 3 people have, the chance to be diagnosed with kidney disease. That's the current
here.
Like, why don't we just fix this? Like, get your blood pressure checked. Do people actually know that, are they getting their blood pressure checked? I know for a fact I have to push my brother to go to his GP. He hasn't been in 8 years. So he wouldn't have a clue what his blood pressure is. But it's general checkups as well. Like, how accessible is that for people? If people have to pay for a general checkup, they're probably not going to get it.
That's true.
That's the way the world is at the moment, right? Especially at the moment, that's what's scary too, is so many people have lost their jobs over COVID because there's no economy, and people aren't going to be paying for things if they don't actually need to go. So the checkup from the GP, unless you're sick, they're not going to go.
Right, unless you fix it, because try to diagnose yourself at home.
Yeah, so that's the scary bit.
So
now, go ahead, Tamika.
So what do you think as people, that we all can do? Because though we have this platform, what else do you think can be done to help spread awareness or sound an alarm about kidney disease?
I think this is a hard one. This is probably another reason why I started the blogs that I did, was to actually raise awareness, to actually, help people realize these are the symptoms. This is what you need to look out for. These are the things you need to do to make sure that you don't end up like me, essentially. So I think, it's just try and share as much as you can. Like if you meet someone and they have questions about, your kidney disease or your dialysis or your transplant, like talk about it. Like there's nothing wrong with you sharing your story either. A lot of people can find it uncomfortable to talk about, but the more you talk about it, the more that you can actually save someone else's life is the way that I look at it. I don't want to go out on my blogs and actually, talk about myself left, right, and center, but it's actually getting them to realize that, this could happen to you. You need to take care of yourself. And it's the only, like, besides getting, news channels on boards, and we've got our non-for-profit organization, like there's so much that we can do individually to try and help. But again, it also, in my opinion, comes back to our government health departments as well. Like they need to be spreading these messages as well. We've all heard about COVID every second hour of every day. So after this, like what's actually stopping them from actually getting some more health benefit talks out there? Prevention checklists, for example, in the letter boxes, like, have you checked your blood pressure this year or in the last 6 months? Have you seen your GP? Like simple things like that could also help people. Have you looked at your diet? Like, are you eating too much salt? Just anything really that could potentially help people go, okay, yeah, I need to do that. Because it's all about saving people to not end up.
Right. I think also because I recently got out the hospital, and when they gave me my labs, the doctors didn't explain anything. So when I went home, I just start checking off and seeing what was below, what was average, what was higher than what it's supposed to be. And I started Googling some information. And I found out, I have decreased function in my liver. Well, that's because I don't have a gallbladder. You get what I'm saying? But the doctors are not explaining labs when you get labs done at the hospital. I think they need to. Also, they need to take a moment or have someone come in here and be like, okay, we just did your labs. You have a primary care. We need you to get this done. Da, 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 da.
Yeah.
Instead of just saying, okay, well, your heart is fine and go ahead out. You didn't have a heart attack. You have a little bit of this going on, and that's it. And I think once they draw your labs, if they're looking at these levels and they see that these levels are irregular, or they're higher, or they see a potential problem coming soon, they should pull you to the side and have someone walk you through your labs and how you can help yourself.
Wow.
Yeah, no, I agree.
Yeah. Now, Simone, you mentioned that you do dialysis 16 hours a week. Now, does the facility that you go to, the satellite, each person has a different treatment regimen, or some people may run less than 16 hours or more than 16 hours?
So I do 4 days a week. So I do roughly 3 hours a session, but then I have half an hour either side, set up, take off, all that stuff. So I'm at the center for 16, on the machine for 12. That's what I do. Some patients will do 3 days, 4 hours a week. Some will do 3 days, 5 hours a week. Some will do 2 days and 4 hours a week. I've previously done 5 days a week with 2.5 hours on 3 days and 2 hours on the other.
So you can make that determination, or do the nephrologist makes that determination?
A bit of both. So with the private unit, so the satellite unit that I'm in, I have a bit of flexibility to be able to sort of choose what works for me as well.
Wow.
Whereas, in the public system, they're quite full, right? So they're trying to get all these patients through. So you might not have as much flexibility. Whereas I get a little bit more because we have the space in the unit to be able to do it. So I've talked with my nephrologist. So when I was doing 3 days, 4 hours, I ended up with migraines. I ended up with reactions. So I just couldn't do it anymore. So I do 4 days in the shorter time, and I actually feel a lot better. And in
Wow.
terms of the fluid gain as well, it's a lot easier. Like, you're running at more of a consistent level. You're not, up, down, up, down, up, down. So Monday nights is essentially my ice cream night because I'm going back on Tuesday. So in terms of, planning around that, it's great. And I pretty much start there at 7 a.m. So our unit makes an accommodation for workers. So if we're working, we get to go in sort of first. So 7 o'clock, I'm there. I'm there for, 3-4 hours, and then I head off to my office. That was before COVID. Now I just head home and work from home. But yeah, that's what we do. So that's where I start Monday, Tuesday,
That's awesome.
Thursdays. And yeah, no, it's pretty good.
For years, I used to try to talk to the doctors because I'm like, is there any way you can shorten the patient's time and just have them come in one more day? And it's like, no, they need to do 4 hours. I'm like, but every time at 3 hours, this patient gets sick.
Yeah.
She has children. She's unable to care for her children. Maybe if she had less hours and more days, it would be better for her, and it'll be better for her heart.
Yeah, that's what we found too. So when I had the 15 kilos on in my first round, my heart had enlarged, obviously, with so much fluid. So what they ended up doing was actually doing those shorter days, shorter times, more days. And that actually helped heaps. So originally they said, at the way it's looking, you're going to need a heart transplant. By doing the 5 days and with the help of some medications as well, I avoided that. I avoided that platform, that going down that road, which was great. But yeah, like, I definitely am lucky to be able to choose, have some sort of say in what works for me, working with my doctors. If I turn around and said, I only want to do 2 hours and, 3 hours on those days, probably not going to get away with it.
Right.
But definitely in terms of, working in with what works with my body, 3 hours works really well, 4 days a week. And the unit has the flexibility for me to be able to do that.
Awesome. So what is your blood flow rate?
I usually run at about 250 because I have quite a small fistula. So I'm on, like, I think it's the green needles. I don't know, 15s, maybe 16s.
But that's
Yeah.
good because that's preserving your heart. People don't understand that when that blood pump runs at a higher speed, 400, 450, 500, that destroys the heart muscles. It's a tug of war like this, and you come off and you're drained and you have no energy, your blood pressure dropping. So many things is going on because that blood is being pulled out so fast.
Yeah, we have a max of 300 over here, generally.
Beautiful.
Yeah, so on 15 gauge needles, your max is usually around that 300, maybe 320.
Wow.
But in all the hospitals I've been in, they've always sort of capped it around that 300.
Wow. Steve, you hear that? So they're preserving hearts.
Yeah, I heard that maximum blood flow rate is you said 300, 350? Oh,
Yeah.
that's awesome. Not that high rate of 500, 450 that they do here in the United States. Do they have PD in Australia?
Yeah, they do. So if you're able to do it, you can do it. Generally, I know patients have done it anywhere up to 5 years usually. Some patients might need to go and do hemodialysis throughout PD if it's not quite working for them, or if there's a fluid buildup that they need to get rid of. But yeah, we definitely have PD, and everyone does that at home over here. Yeah.
Wow. This is amazing to learn about how they do dialysis in Australia.
Wow. I think like the US could take a page out of their book, especially with the blood flow rates.
Right.
Try to tweak some stuff. to
But
benefit the
they
patient.
so greedy.
Right, but I mean, give the patient quality of life. Coming off that dialysis machine drained and lifeless is not quality
I
of life.
know.
You know, you have patients ready to give up because they can't even enjoy themselves. And the minute they do feel good is Sunday, and they have to go back to treatment on Monday, or it's
Yeah.
Monday, sorry, and they have to go back to treatment on Tuesday.
Yeah.
Simone, Lisa want to know, have you ever passed out on the machine?
I was pretty close once, and that's when we established that my dry weight was too low.
Right.
Yeah. So yeah, I was pretty close once, not fully passed out though. Like
But
everything just
other
went
than that,
blurry.
by you running 4 hours a week, I'm sorry, 4 days a week at the slow treatment pace, you don't experience no cramping, no nausea, none of the side effects that somebody may do if they was running.
I will get cramps if my dry weight's too low. So if I've started to gain weight and we're not 100% sure what my new dry weight should be while we're playing with that, I might cramp up. But other than that, for myself personally, I hardly ever get symptoms. I might get the occasional migraine. But again, that's why we've tapered the hours and the days. But that's for me, the migraine, if I was to be sick, it would be due to a migraine, not because of the machine itself.
Right.
Wow.
Have you ever used CBD oil for your migraines?
I've heard about it, but I haven't tried it yet.
Okay.
To be honest, I wouldn't even know where to get it.
Oh, okay. So it's not available like that over there?
No, it's not pushed around anything around here as well.
Okay. Wow.
Wow, this has been a great interview, Tamika.
Yeah. Just another question. So what percent of your kidney function do they put you on that they say you're in end-stage renal disease? Because I spoke to a person before, and he's from Australia. He said that he had to wait until he was at 10% before they would even do anything for him. Remember I talked about that guy, Steve? Years ago.
Yeah.
Yeah, look, he's not wrong. But like I said, I was on 2%. It can be anywhere from 2 to probably 3 to 10. They'll start having conversations at, that 22, 25 percentage mark. Like, it's probably going to be soon. Because at that point, all it takes is for you to get the flu and you could be there. So it's getting you prepped and ready at that point. I know that at the moment, there's quite a number of specialists that are now having discussions at conferences around the globe about potentially starting a little bit earlier, but actually starting patients on 2 days a week compared to the 3 or 4. So it's actually gentle. It's not as rough on their bodies, but it's also trying to help retain their kidney function and retain, their ability to be able to still pass urine as well. So it's trying to preserve that for as long as possible. So using the dialysis to bump it up rather than using it as a full-blown treatment. So I remember one of the specialists at my unit coming back from a conference maybe about 18 months ago now, talking about that. So I know it's definitely being brought up in global conferences across the world as a new form of, a way to treat patients. But the 10% sounds about right. Because again, it's that space factor too. Like we don't have space here. Absolutely. They'll put patients in, they'll find spots for them, but it's not like they would have sort of that benchmark. And it's the same with transplants. So I'm not sure what it's like over there, but you have to be on a deceased donor list. You have to be on dialysis. So you can't be close,
Can't get a preemptive transplant.
Wow.
Well, you can if it's a live donor.
So if it's alive.
If someone's matched with me, and they can donate, absolutely. But from the deceased donor organ donor list, you have to be on dialysis to be able to be considered for a deceased organ.
Wow.
Yeah.
I wonder if it's like that here in the United States as well. And far as preemptive, that it can only apply to a living donor.
No, I think we're going to get a transplant coordinator on here. We're going to find one to come and answer questions, and we can ask them that.
Yeah.
Oh, absolutely.
And I think from what I've heard and what I've seen previously as well, I could be wrong. I have heard that for transplants to happen in America, you need to be able to prove that you can afford the medication afterwards, whereas our medication runs through that Medicare. So yes, we have to pay for it, but it's all through the hospital, like it's the public health system. So you would either go on a payment plan or things like that. So it's not things that we would have to pay upfront. We still have that Medicare assistance as such. And I guess from another transplant perspective too, depending on your distance from the hospital, you may be entitled to some funding as well.
Now, would that be for the rest of the time you had that transplant, or is it a certain amount of years? Like here in the United States, Medicare only pays up to 36 months.
So we have Medicare for every day of our life. If you're an Australian citizen, you have Medicare. We pay the Medicare levy at the tax time every year. Now, depending on your income, depending on what benefits you're on, will depend on those discounts that you can get through Medicare. Doctors have a discretion. So doctors can bulk bill straight to Medicare if they choose. They don't necessarily have to, but they can. That's something that they can do. So Medicare will cover portions depending on what other, I guess, health benefits you're entitled to. So, for example, for me, I asked for just a healthcare card on top of my Medicare, just to reduce the cost of medications. To be entitled to that, I would have to not work, and I would have to be a single mother of two. So, yeah, there's hoops and loops.
Right.
So no, I'm working. Thank you. I can still work, so I'm quite happy to work. And yeah, so there's definitely levels as such that you can try and apply for different benefits. But in terms of overall Medicare, everyone gets it from the day of birth through to the day of end of life, if you're an Australian citizen.
Wow.
Wow.
This is wow. This has been an hour of great information.
Yes, it sure has.
So, wow, what can you share? Because we're definitely coming down to the end of our broadcast. But what could you share with our U.S. warriors watching tonight? What message can you give them from Australia pertaining to kidney disease?
Probably that you're not alone. Everyone, we're all in this together. It doesn't matter what time it is over there or what day it is, what country you're in. I think, there's heaps of people globally that are going through this. We just don't have a platform where we get to see each other. So, I can connect with people in Australia very easily, but I can't necessarily connect with people across the world either. From a percentage perspective, we wouldn't have a clue how many Americans are affected. We wouldn't have a clue how many, South Africans are affected. And I think that's also the hard bit as well, is we look at it from our own country perspective, but we don't think of it often as globally. And that's probably, another reason why I started, my blog pages, is because it's just like, what, we need to share this. You're not alone. It doesn't matter what age you are. We're all in this together. And yeah, like you just got to have hope. You've just got to keep going. Like, don't let it stop you. Like, I plan to study in 6 months' time. I'm just going to do it. It might take me a little bit longer. There's going to be weekends where, I'm going to just want to stay in bed for a day. And that's actually okay. But, just one day at a time, just keep going. We'll all get there.
Awesome.
That's awesome.
What I admire about you, real quick, Steve, what I admire about you is that you still push. You have your own business and you're still working and you haven't truly given up. Some people have given up where they, dialysis is all I'm doing. I'm not doing anything else. And you're still creating purpose for yourself.
Yeah. Yeah. I think it's just, home is the solitude. Like, home is away from, my full-time job. Home is away from the dialysis. So I want to be able to do things like, whether it is, go for a walk, climb a mountain, whatever it may be. But yeah, it's, just get out there.
Wow.
That's awesome. That's awesome. Dad Vice says, best of luck to you. Outstanding job. Yeah, he's on YouTube. If you ever get an opportunity to view YouTube, check out his page. He got about like more than 80,000 subscribers. He got some great shows over there. And maybe some people from some warriors from over in Australia could benefit as well.
Right.
Yeah, that'd be great.
Yeah. So, Tamika, this has been an awesome show.
Yes. Thank you so much for spending Friday morning with us, because it's Friday in Australia.
It's lunchtime now.
Yes, Friday brunch.
Friday noon. Wow.
Yes. Yes.
Will you be willing to come back on that show at a later date just to share an update and what's going on in Australia?
Sure. Yes.
Yeah, that'd be great.
No. Also, Simone, and this may be a reach, we have a show where we allow warriors to try to tell people that they need a kidney. It's called Warriors Quest. You could also be on there. You never know who's out there listening. You never know if there's someone in Australia watching the show that may donate a kidney to you.
Okay, cool. If you want to send me through the info, I'll have a look.
Sure.
Oh, absolutely. And plus, just by you working with your blog and you trying to do the same thing we're trying to do, we're what you call it, Tamika, when we're connected now.
Yes.
So anytime you want to come on any of our shows and broadcast anything, you're more than welcome to do that.
Awesome. Thank you.
You're welcome. Thank you.
Yeah. So again, Simone Moniz, thank you for coming on Urban Renal Talk with Tamika and Steve. And definitely Tamika will send you the information for our other shows.
Yep.
Awesome. Thank you.
You're so
all right. Take care.
God bless.
Enjoy your Friday and have a nice weekend.
Thank you too.
All right. Bye-bye.
Bye.
Lisa Baxter said she could come on her. She first to grab one. All right, Lisa.
Her information also.
All right, Lisa. I see she jumped on it quick, but that's awesome. Thank you, James. We appreciate it. Oh, James, I got to come on your show, or me and Tamika and we got to be guests on your show. But yeah, Tamika, this has been a great show. You just come through with the international guest, so that's going to be your job.
International. I mean, we really do need to see what's going on outside the country, that maybe we can bring some tips here.
Yeah.
Especially with the lower blood flow rate, and show that it does work. Fight with these doctors that it does work. I don't have to run at 450. Excuse me. You can and you can show proof that it does work. Just bring me in another day. I don't have to be here for 4.5 hours. I could do 3 hours one day and 3.5, and then 3 hours and 3.5.
Tamika, this is the thing about that, and I understand, but I guess as well as I know that a lot of these clinics may not create that space for patients to come in like that. But
if they
this
could
is
come
the
in for
kicker.
extra treatment, like if they got to fight for it, the worst thing they
Right.
say
No, the
is
extra treatment has to be just now they do it. Well, I don't know
it has to be
before I
justified.
left, it has to be justified. But you know what can make that even better is going to home dialysis.
Right.
Now, if they do that, then they got all the leeway in the world.
Right. Right.
You know, 3 hours, 2 hours, 5 days a week, however you want to do it.
Right, but not everyone can do home dialysis, you know.
I know.
You know, and it's just taking a wear and tear on so many patients that there's so many patients ready to just give up.
Yeah.
Just being able to have a piece of life. That's all they ask for.
But you know, with a lot of those nephrologists, if someone, I can see someone saying, you know, Dr. So-and-so, I want to do 4 hours and do this. And then he may say, oh, I think you're doing fine just like where you're at. And then they may accept that answer and, you know, move on. But you're right. Huh?
They have the option to change doctors. Change doctors. I've seen one patient, Steve, change doctors 3 different times because she didn't like the outcome of the doctor that she had. And that last doctor,
you can definitely do that.
Change doctors.
Right. But what do you do if you're in a place where the same group of doctors, there's no other doctors but one group of practitioners in that town?
Oh shoot. Then I don't know.
but no, I know exactly what you're talking about. And I think we're a little different here than Australia, where it seems like they have a lot of leeway there.
Because they're paying for their treatment. That's why it's this right here that's allowing them to have so many options versus the ones on Medicaid. There's Medicare, they're stuck in center on top of each other because there's so many of them in one center. Everyone's trying to get dialyzed, and there's not as many centers as it is here. Versus where she is, she's paying for her treatment through private insurance, and there's not a lot of people on private insurance like it is the people on Medicare.
Right.
So she has that flexibility.
Yeah, this disease, man, this is something else.
But Steve, that flexibility gives her a better quality of life because she's in control of her treatment. She's really in control of her treatment.
Yeah, but on some of that, she misses some things as well, like the dietitian and the social worker component. So it's almost seemed like give and take.
Right, but even at the same time, because all those patients are stacked on top of each other, the dietitian and social worker are overwhelmed. So they don't get the quality that they need. In those
I don't know. I haven't been over there to see it, but
we're gonna find out. I'm gonna find somebody that's in center, and we're gonna finish this debate. What do y'all think?
It's not no debate with me.
We're gonna debate. We're gonna find a fact.
All right. But yeah, looking forward to another international guest. I got a doctor for next week, Dr. Steve Rosansky. He's an author. Okay. And he's going to be on. It's going to be a great show.
Okay, awesome. Now find someone else international.
Oh, absolutely. Again, great job. And guys, share this broadcast so other people who didn't get an opportunity to watch tonight can view this broadcast.
Yes.
Especially seeing another warrior from a different country sharing their story and going through treatment just like warriors over here. But again, it seems like they have a little flexibility of days and the time, shifting time, and that will work for them. So you're right, Tamika. You definitely got to advocate for yourself.
Yes, most definitely.
So
even when they say no means next opportunity. I tell my children that just because you hear no don't mean you stop. It means next opportunity. Next opportunity.
Oh, wow.
Mm-hmm.
Wow.
No does not end anything, like unless you're dealing with girls, something like that. But no in life, besides that part, it means next opportunity. Okay, because you said no don't mean someone else is going to say no. Because you said no, someone else is going to say yes. So I'm gonna keep getting my no's until I get to my yes. Keep pressing on.
Right. Yeah, that happens in transplant. I think we had a guest that said one transplant place told him that he wasn't qualified because of the weight, and then he went somewhere else, and they were able to get on that transplant list and successfully receive a kidney transplant.
Yeah. So thank you for joining us on another edition of. Go ahead, Steve.
No, I didn't say that. Was Lisa Baxter put something up there.
Oh, delayed, not denied. That's right. So thank you guys once again for constantly supporting us. Thank you for watching another edition or another show of Urban Renal Talk with Tamika
and Steve.
Yes. And remember, your kidneys matter. Share and like.
Absolutely. Have a great evening, guys. See you, Tamika. Talk to you soon, babe.
Yes.
All right. Peace.
Good night, everyone.
Good night.